It's a big month here as we shine a light on the growing number of young women diagnosed with breast cancer each year. In our Faces of Breast Cancer series, we're meeting the women taking control of their health and sharing their personal stories.
Brave women. Today we're highlighting 35-year-old Wren Morrobel living with metastatic breast cancer.
When people hear stage 4 metastatic breast cancer, they do tend to think of a death sentence. My message is that I want to show that it doesn't always have to be that way. I was diagnosed at age 29 years old with early stage triple negative breast cancer. It was stage 3. And my husband and I, we had been engaged for about a year and a half at that point. I was an elementary school teacher teaching 5th grade. I did chemotherapy. I did a double mastectomy. I did radiation. I did reconstructive surgery. It was about 6 months into the journey, and a CT scan showed that the cancer had actually metastasized from the original area, which was my breast, to my lungs and also my skin. I was able to get on this life-saving immunotherapy, which was fairly new in the breast cancer space at that time. Just the stars aligned for me in that moment. And I have been deemed no evidence of disease for 4.5 years because of this treatment. When I go to treatment, I have minimal side effects, but I'm really only struggling with these side effects for 48 hours. And then once the 3rd day hits, I'm back to normal, feeling good, feeling way more energized, and feeling like I can take on the day. Mindset is probably the most important thing that I've learned. There is a beautiful life out there.
She's an example there. Breast medical oncologist, Dr. Elizabeth Comen joins us now, and always good to see you. But, Wren's story is an example of how cancer treatments are getting better and better by the day. So can you talk about the latest developments?
Absolutely. And her story is so inspiring. And over the course of my career, I've had many patients like Wren, and the landscape of how we care for breast cancer patients has changed for the better, given that there are so many newer and better treatments for breast cancer patients, and particularly for metastatic disease. Just as we are all individuals, we are understanding on a very specific genetic level what allows a cancer to grow, like breast cancer, and how we can target it very specifically.
Let's talk about the metastatic of it all, that stage 4 cancer. Yes. A lot of people don't understand what these different stages are. Can you break that down for us?
It's confusing, so I'm so glad that you asked that question. When we think about stages of breast cancer, what we're talking about is a couple different things. First is the size of the tumors and if there is potentially any lymph nodes involved. If a breast cancer is localized to the breast and or lymph nodes involved right underneath the armpit, that's either stage 1, 2, or 3. Stage 4 metastatic breast cancer means that breast cancer cells have spread from the breast to another part of the body, like the lung, the liver, the bone, or the brain. A lot of times people think they've had breast cancer and then develop a lung or a bone cancer, when in fact that's not the way we think about it. It's breast cancer cells living in another place in the body, so metastatic breast cancer.
You do such a great job of explaining these concepts, because I know firsthand how difficult it is to understand.
Yes.
What advice do you give to patients when they're diagnosed with cancer later in life, or excuse me, at a later stage?
Yeah, so there are a couple of very practical things. First, we know that it's so important to talk to your doctor about what do you value in your life? What's really important to you, so your doctor can really hone in on what's going to help you thrive through any diagnosis. And then practically asking your doctor, are there any clinical trials that may be relevant for me? One big misconception is that clinical trials are a last resort, when it may be your best option, because research is the reason why we have so many better, newer treatments available for patients. The other thing to ask about is genetic testing, both hereditary genetic testing to see if you've inherited any risks for breast cancer that we could target, but also genetic testing of the tumor itself to understand how we might be able to personalize your treatment based on what genetic changes evolved in the cancer.
But for those who are watching and see Wren's story and want to try immunotherapy, this type of treatment, what do you say to your doctor?
Ask your doctor, because the type of breast cancer that she had was appropriate for immunotherapy. It may not be appropriate for all types of breast cancer depending on a woman's diagnosis, but that's an example of a new treatment that's really changing and improving so many lives of patients with breast cancer.
I have to tell you, watching her story, she's 35. 40 is the age they tell you should get a mammogram. So, and you've been such an advocate for women advocating for themselves.
Yes.
What do you say to those younger women who look at a story like this and they have their own concerns, but they're not sure how to express it to a doctor?
We share in those concerns. We know that there's a rising rate of young women with breast cancer. Talk to your doctor about your personal risk factors, your family history. It may be important that you start screening for breast cancer before the age of 40, depending on your family history, and also get to know your body. Have a sense of what your breasts feel like at different times during the month. Think about doing self-breast exams. There are lots of tutorials online for how to do it, so that if you do feel something that's concerning or see something, you feel empowered to talk to your doctor about it.
Dr. Comen, thank you so much. It's so important that you're hearing this information that you're sharing.
Thanks as always for having me.